Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
Hi, my name is Amy, and I'm a 34-year-old nursing student in Los Angeles. And in a few months, I'm embarking on a new journey that is nursing school. So I will have no free time soon. So I've been thinking about some plastic surgery, and I'm interested in getting breast augmentation. Every time I go shopping, I get depressed because there's so many clothes that I just cannot even try on. I know I look terrible in it. So I heard about Dr. Kassabian from a friend of mine. He did great work with her, and I'm gonna go see him and see what he says.
Today I'm meeting with Amy, who's referred by a colleague of mine. I know she has some concerns about her breast and maybe some of her facial features. So let's meet her.
Wonderful. Let's get you checked in. Great.
Right, you're all checked in. Just have a seat there and we'll put you in a room.
Hi Amy, I'm Dr. Kassabian.
Hi, Dr. Kassabian.
So nice to meet you.
Nice to meet you.
What brings you in today?
I'm thinking about breast augmentation. I'm really just looking to fit better in clothes, and it's time.
Fantastic.
So I have a few months off of school.
Okay.
I'm in nursing school. So I thought this would be a good time to do it.
Great. How did you hear about me?
I know a friend of yours.
Okay.
Yeah.
Okay.
Yeah.
Fantastic.
Yeah.
So what cup size are you now?
I'm A.
A. And what cup size would you like to be?
I would love to be big B.
Big B.
Big
Okay.
B.
Big B.
Big
Okay.
B. Yeah.
How tall are you?
I'm about 5'7".
5'7".
Mm-hmm.
Okay. So probably like a big B, small C.
Well, let's see.
Yeah. Because most often patients come in, they want to look be conservative, be very small.
Right.
But then it ends up being too small and regret it. So I'd rather you have because you have the height,
Right.
you have to match it to your height, shoulders, waist.
Okay.
Okay, to have a nice proportions.
All right.
All right. Anything else?
Can we do anything? I feel like I have a little extra in the chin area.
Yeah, that's very easy to do. You don't have a lot of loose skin,
Mm-hmm.
so that's some extra fat there, and some laser liposuction in that area would look fantastic, and it would highlight your jawline and
Right.
give you a better neckline. Yes.
Okay.
All right. So next we're gonna go in and I have a machine that does a scan of your chest,
Mm-hmm.
and that way we can put in how a B would look like, how a C would look like.
Great.
And also we'll do sizing with actual implants, and you'll see for yourself on your body how it's gonna look like.
Excellent.
All right, so
All right.
let's go.
Great. Thank you.
Okay, so I'm gonna need you to stand. Actually, where you're standing is perfect. You just wanna come over here. That's really good. Make sure that your shoulders are nice and back there, and you open this wide so the camera can get a good, perfect shot of you. Wonderful. Just stay there. Don't move. Just give it 1 minute. 1 second there. And scanning.
So you see this is the before, and that's what's a small C would look like. Okay. Is this size okay with you?
We can also do, it's really easy, you can also see what a 400 will look like, if that just be for fun.
That would put you in a D
That'll hold me
category.
in it for a while.
Okay.
Okay, so this is a 275cc. This will accomplish a 300cc look, and it'll give you a full B.
All right.
How do you feel?
Maybe slightly bigger.
Slightly bigger?
Yeah.
A little
Okay.
bigger.
I'm
Okay.
gonna go ahead
Yeah.
and place those up.
You know, that really is everybody's #1 complaint about breast implants. Everybody always says they should have gotten just a little bit bigger.
Okay.
So you want to go ahead and put these on in there?
Just 300.
All right.
So give you a C.
And we can give you a tight muscle shirt here so you can see what it'll look like and how it could possibly project. But this implant would definitely put you at the C range. So you see the difference? There's definitely a little bit of a...
Yeah.
Looks good.
Does look good.
That's a great size on you. It
Yeah.
really complements your thin frame. It's beautiful on you. Like Dr. Kassabian says, you can look great in a bikini,
Right.
but you'll also look wonderful in a business suit or your nursing, your nursing scrubs.
That's right.
Yeah.
Looks great in those.
Wonderful.
I like it.
Yeah, good.
Okay.
Let's get the doctor in here to see what he thinks.
Great.
Amy, so we've done the simulation and the sizing, and I think you like a C, small C, so that's gonna be an implant somewhere around 325, 330 cc.
I think that looks great.
Yeah, and I do too, because you're tall and this is gonna match your figure very well.
Right.
Okay, and the neck liposuction, that's gonna highlight your jawline and give you the nice neckline you're looking for.
Wonderful.
All
Sounds
right.
great.
So next I'm gonna have one of the patient coordinators help you choose a date that's the most convenient for you,
Okay.
and I'll see you at the day of the procedure.
Wonderful.
Fantastic.
Thank
Nice
you so
meeting
much,
you.
doctor.
I just had my consultation with Dr. Kassabian, and I think we came up with a really good plan. After seeing the imaging software, I decided that a small C would be perfect for me. We've also decided to do a little chin liposuction. I'm so glad I'm finally getting this done, and I cannot wait.
Amy's concerns are the proportions of her body, specifically the size of her breasts. Amy is a tall girl with prominent shoulders, and in order to match those proportions, she needs to have a little bit fuller chest. So the recommendation in that area will be breast augmentation using a gel implants, the silicone implants that will be placed under the muscle. The other concern that she has is some fat deposits underneath the chin with some loose skin in that area. And for that, my recommendation would be to do some laser liposuction. The laser will tighten up the skin, will melt the fat, and with the liposuction will get the melted fat out. So that will give her the defined neckline and jawline that she's looking for. Now that Amy has some free time before she starts nursing school again, this is the perfect time to do it. So we're gonna go ahead and get her scheduled.
Well, it's surgery day, and I am really, really excited. A little nervous, but I researched Dr. Kassabian a lot, so I know he's wonderful, and people have recommended him, so I know I have nothing to worry about, but it's always a little interesting going under the knife. But wow, am I really looking forward to going bikini shopping later this week.
Good morning, Amy.
Good morning.
How are you?
I'm well, thank you.
Okay, today's your surgery day.
It sure is.
Fantastic. So let's go over the plan.
Okay.
Neck liposuction, tiny incisions behind your ears and one under your chin.
Okay.
Then you're gonna wear a bandage, a garment here. That's designed to minimize your bruising and swelling.
Okay.
Okay, the breast augmentation, are we still thinking about a small C?
Yes, we are. Yes, we are.
Okay, perfect. I think that's perfect for you because you're slender, tall.
Right.
All right, so both of them very comfortable procedures. You should recover very nicely.
Wonderful.
All right.
Great.
So if you have no further questions, we'll go ahead and start.
Let's do it.
All right, give me a big hug.
All right.
Amy just went to sleep. We are now going to start breast augmentation and liposuction to the neck. We're halfway done. We finished with breast augmentation. We're now going to start with the next procedure. Everything is going well.
Just finished Amy's surgery. Everything went as planned. I did the breast augmentation with gel implants under the muscle, and that came out looking very, very nice. And next I did the liposuction to the neck. She should recover quickly, and I'll see her for follow-up tomorrow.
So I had my surgery yesterday. I am at a wedding
feeling fantastic. I was so nervous that I didn't even RSVP to this wedding. But at last minute, I'm like, I feel fine, let's go. Nothing hurts, everything, my chin feels amazing. There's zero pain in my boobs. All of my fears are out the window. It was such an easy experience. I cannot recommend Dr. Kassabian enough. He was phenomenal and I look great.
It's been 6 weeks since my surgery, and I'm about to see Dr. Kassabian for my post-op consultation. I think I've been healing great. The scar looks good, but it'll be good to get verification from the doctor that everything's perfect and as it should be.
Hi Amy, how are you?
I'm good, how are you?
I'm great, thank you.
Good.
So it's been 1 month since your surgery, and doctor did breast augmentation and chin liposuction.
That's right.
Okay, I'm just gonna ask a few questions and I'm gonna bring the doctor in.
Okay.
How are your scars healing?
They're healing really, really well. They're not raised anymore, and I can tell they're really fading quickly, so they're doing
Good.
great.
Perfect, that means the integrity of your skin is really good.
Good.
And any discomfort? How's your energy level?
You know, I was back to work in a few days, so the energy's been great, and the soreness has been very, very minimal. It's been really good.
Good, so
Yeah.
you are a great patient then.
Thank you.
I'm gonna bring in the doctor. He's gonna go over this in more detail with you and show you some of the breast exercises that you need to do.
Okay, great.
Okay,
Thanks.
you're welcome.
Hi, doctor.
Hi, Amy. How are you?
I'm doing great.
Good. You look fantastic.
Thank you.
Yeah, and everything's healing well, I see.
It's been great. I haven't had any pain. The scar is fading. It's not bumpy anymore. I think things are going really well.
Good, good, good.
Yeah.
Well, the neck liposuction, there's no bruising.
Mm-hmm.
There's a little bit of swelling, but we won't see that. And you're going to see better and better results over the next few months. And the breast augmentation looks fantastic. So, but I want you to keep on doing the massages.
Okay.
Okay, so just push them from top down so the implant settles into place. And also from the side, push them towards the midline so you get as nice of a cleavage as possible.
Okay.
All right, so next I want to be checking your scars and taking some photos, so let's go ahead and do that.
Okay, great.
Okay, so the scars are healing real well. So like I said, put one hand here, one hand on the other side. Yeah, do the massages. Amy's healing very nicely after her surgery. She's 1 month out, and already I can see the results. She's happy with the definition that she has in the neckline, but I expect to see more of a result in the next upcoming month as the collagen buildup tightens up the skin, and we'll see more of her jawline. So in the next 6 months to a year, we're going to see more of her progress. As far as her breasts are concerned, they are settling nicely, but there's more room to settle. So I want her to continue with the massages that she's been doing so that we have the optimal results. Even though Amy is a beautiful girl, she still has specific concerns that bothered her. The fat and loose skin underneath her chin was an issue to her, and that was easily taken care of with liposuction and laser. The proportions of her body also was an issue, especially not fitting in the clothes properly. Breast augmentation was the perfect solution. Now with these two procedures, she's going to look better in her clothes and feel much more comfortable about herself.
This has been such a wonderful experience. I just got confirmation that I'm healing wonderfully. I have to do the exercises a little bit longer, but other than that, the long haul is over. It's been amazing. The pain was really non-existent after like the first day, and I think everything looks wonderful. I should have done this ages ago. I feel so much better about myself. I look better in clothes, and I'm just all-around more confident person. Dr. Kassabian and his whole staff have been so wonderful through this process. They answered all my questions. Dr. Kassabian did a great job, and I'm so happy with the results. This is one of the best things I've ever done in my life.